Well, welcome to CRT 20. I'm Dr. Megan Coylwright, and I'm here today with Dr. Ramon Quesada. And we're going to be talking about increasing patient awareness about left atrial appendage closure to reduce the risk of stroke, something we're both very passionate about. You know, I'm always surprised about how I'm meeting patients in clinic who have never heard of left atrial appendage closure before. Has that been your experience, and how have you addressed it?
Yes, you know, it's since I think since approval, it's been a lot more awareness about the procedure and the options. Patients don't want to take pills for a long time, and if they can avoid taking anticoagulation, they approach us.
And as the leader of your structural heart program, I know a lot of the procedures you do and that you're passionate about improve symptoms for patients. Now, this is a procedure that really is done for preventive measures.
Correct.
Have you found that it's been as rewarding for you as a physician as those other procedures that help people feel better?
Yes, in the sense that patients who have the high risk for taking long-term anticoagulation already had a stroke previously, and they're so afraid of having another episode, they want to take the anticoagulation, but they have complications. Those are the patients who really come asking you, please do it. The other is the young patients that for quality of life or for their profession are obliged to change their lifestyle because the anticoagulants, they want to have an alternative. And I think closure of the left atrial appendage it gives that opportunity to the patients.
So what you just said is sometimes controversial, and that is that we should really let patient preferences drive some of our decision making. I think there are a lot of people out there that don't realize that left atrial appendage closure is approved for patients who have, quote, an appropriate rationale to avoid a long-term anticoagulant. And you've just mentioned some. Sometimes it's profession or quality of life. And so when you're talking to patients in the office, how do you present all of those choices to people? What are some of your strategies?
So one of the strategies, number one, the patients most of these patients are referred to us. So education is very important. They rely on what we as a specialists are going to say, and you have to give them all the options. Okay, this is a procedure. Yes, it's very safe, but it's a procedure. The medication is easier to take than to go through a procedure, which might be uncomfortable or might have complications. If you have the complication, it's not 1%, for that particular patient, it's 100%. So you have to be very open and explain all the details and the pros and the cons. The pros is you're going to get rid of a drug that has potential problems in the future, bleeding, for example. And on the other hand, if you're going to be able to change their lifestyle and they're going to be able to do more things that now they can't, they're limited because the limitations of oral anticoagulation, the patients have the right, I think, to decide what is their best choice, as long as it's within the clinical and medical appropriateness.
Mm-hmm. I think what you're really highlighting is the importance of a shared decision-making approach. You started by talking about the risks and benefits of the procedure, but then the second part that's so important is listening to patient preferences and what's important to them, which might be different from what's important to us. And you did mention the fact that actually the risk of the procedure is pretty low. You know, our most recent data suggests that the risk of a pericardial effusion, the most common complication, is about 1.6%. And I think we've seen in real-world data that having the procedure is very low risk. Do you think that's an important message to get out, or do you think people understand that?
I think it's an important message, and it's important for the non-cardiologists, other medical disciplines, to understand that this is a very viable procedure, and it will really change the lifestyle of many patients. And you know, the older patients are the ones who benefit the most. We know that. To prevent strokes from atrial fibrillation, but are the ones who have more complications of oral anticoagulation. Yes, this is a procedure, but today is a very safe procedure, and I think we have to explain that to educate the doctors, the community, the patients, and help them to make the proper decision.
You talk about educating the community, and one of the topics today is how we can raise awareness about this as an option. There is a new commercial that's out by the main company that makes Watchman. What do you think about direct-to-consumer advertising, or for us as physicians to go into the community? What might be the appropriate step for clinicians that are offering this therapy, but they understand there's a lack of awareness in their community?
So one of the things we have to really communicate with our community, and that's one of the things that we old doctors shy of, because I don't want to go talk to a group of people. It's not my thing. I don't have time to it. But really, we provide care, and we're trying to change patients' outcomes. And the only way to do that is to educate patients to help them. This is not like going and selling a car. This is something that we are offering to patients to improve their quality of life and long-term outcomes. We have data to support that as an alternative to the traditional standard of care, which is long-term anticoagulation. So it's important that we are able to transmit that message to the community, not only to our patients, but in the community in general. So what we did I'm from Miami, in my community is they're very active patients associations that they want to have the procedure. They talk to their friends, they get all together, and then they ask us to come and talk to them. So our coordinators are very active on this, and we come and talk to them. We talk to the primary care doctors. We talk to the hospitalists. So we do a lot of education. We're not saying everybody should do it or should have it. We're saying you have to be aware that this is an option that might help you in case that you need it. Mm-hmm. And then leave the decision to the doctors who are taking care of these patients. They can talk among each other, and then at the end of the day, it's the patient who will decide if they want to proceed or not to proceed.
I love that example you just gave, and that is really patients and patient advocates driving the education in the community. That might be a good place for clinicians to start, to ask their patients
Yes.
who've had left atrial appendage closure, do you think that there is awareness in our community? Are you someone who'd be interested in providing more information about this therapy? I know from my perspective, I was surprised with how incredibly grateful patients are at that 6-week visit when we show them their images of the device healed and say, you can now stop anticoagulation. It is life-changing for a lot of patients. And I've had some of them say, give me brochures, I need to pass these out. A lot of my friends don't know. And I think part of what's important is not that we're trying to sell a product or push someone towards a procedure, but that patients understand there is a choice. And as long as they understand that there's a choice, we may even see that we can increase compliance with anticoagulation if they know that they've been able to select something that's right for them.
That's right. Even if they don't have this, and you just mentioned it, patients understand the disease, the process, and they become more compliant with oral anticoagulation. Excuse me. So it's important. I think education is the most important thing, not only for us as physicians, to educate our patients and our communities, that there is options, not only for left atrial appendage closure, but a lot of the things that we do in medicine.
Mm-hmm. Stroke is so devastating. And so I do think we have a responsibility to educate our communities, both on the need for taking anticoagulation and why, or having an option like left atrial appendage closure.
So, now that you mentioned stroke, one of the most interesting things, we have a very strong stroke program in my institution. And the patients, once they have it, they have the emergency procedure for stroke, they become advocates, and they are like very active in the community. So they invite us to talk to one of the stroke meetings, first for the doctors, and then we would deal with the patients who have had strokes. Remember, 20% of those patients have atrial fibrillation or more. The fact of the matter is that particular source of a group of patients are really became a very strong advocates of the procedure itself. Even though they haven't had, the fact of the matter is that if they would have known before they had the stroke, they would have definitely, because a lot of these patients, some of these patients were already anticoagulated, but they were not therapeutic. they were not therapeutic, or they skip a dose here, a dose there, and they didn't take it for a week, and they have an event. So those patients, now that they have a stroke, became really aware of it, and they are very advocates of more education.
What a great point to close on, and that is when we're thinking about increasing patient education and volume for left atrial appendage closure, we should first look to our patients and have them guide us. What is appropriate locally for
Absolutely.
education?
We have to listen.
Yes, we do. Thank you for joining me today.
My pleasure, Megan.